Hi, welcome to MG Life Hacks. I am your host, and I started this channel for anybody with Myasthenia Gravis or caretakers who are just curious about the random and bizarre that tends to come with this diagnosis. Today's challenge that I wanted to talk about specifically has to do with eyes, not vision, not to be confused with myasthenia gravis that is just in your eyes. Some people have it just in their eyes. I can't speak to that. I can speak to generalized myasthenia gravis. It does wear out my eyes. Yes, they do start to blur, and I do get double vision every single night because I work a desk job at a computer full time. So it's pretty wearing. But my optometrist is really good, and the glasses that I usually wear are very good for it, and I am due to get some new ones or an update. However, what I wanted to talk about primarily is infections, styes specifically. For the last couple of months, I've been visited by some uninvited guests around my lash line, and unfortunately, I used to get these pretty rarely before this diagnosis. The last couple of months, I've gotten them more frequently because of all kinds of different things going on in my immune system. So that being said, I did want to talk about different things that have worked for me to delay or put off or assist with, in conjunction with medication if that's the route you have to go or choose to go. I am all for antibiotics, but they wreck my stomach. And I'd also like to prevent infections where I can. And for the most part, this routine works, which is not easy, especially if you have weakness in your arms or your fingers. So you might have to make some adaptations to it, but sometimes it's just modifying things the right way and finding out what works for you. Anyway, diving right in, my eye infections are caused by blepharitis, which is like insanely dry skin. And what happens is it blocks up the pores by my eyelashes. Sometimes it's, on the underside of the eyelid, on the top or the bottom. And what'll happen is I will feel something, and then the next morning I will wake up and my eye is either swollen shut completely, or I'll get really lucky and it'll just be red and swollen and, like with a bump. And then I know I have to call my doctor and get a prescription for it. Now, myasthenia gravis, you can't take antibiotic eye drops. Those are a big no-no. They are on the list of cautionary drugs. And if you go to myasthenia.org, they have a cautionary drug listing. And the antibiotic eye drops are definitely don't take those unless your neuromuscular neurologist says so, or your general practitioner feels super comfortable with it. Because everybody with this is going to be a little bit different in some ways, but be very careful about those. The ones that I take from my doctor, it's a mixture of amoxicillin and clava something. But you can take a generalized pill by mouth, and hopefully that will work and get rid of the infection. If it's, a true infection. What you can also do in the meantime to work and treat it in conjunction with the antibiotics, or just do on a regular basis to prevent them, like I am, it is considerable. So if you have trouble getting up, getting down, get yourself to the restroom with your supplies in one trip and just stay there like on a stool or something to keep you close to the sink. What you will need to do is, first of all, you'll need to wash your hands. Then you need to wash your face, all of it, just, close your eyes, plain soap and water. Next, you dry off your face, and then what I will use, and this is, not everybody needs to do this. I do because of the blepharitis. It is relentless. It's because I'm reducing prednisone and my immune system's waking up. So this is how it's expressing itself. But this is called OcuSoft Lid Scrub Oust. It's this little guy. Yoink. Let's try and get that to focus. Of course it won't, but oh yay. But I'll take one single pump, put it on my fingertips, close your eyes, and leave them closed until you wash this off, because it has tea tree oil in it and it will burn if you open them or if it gets in there. So bearing in mind, to recap, you have washed your hands, you have washed your face. You then put a pump of this, put it on your eyes and your eyebrows. You can rub it in if you want to, and just make sure you get right by your lashes. But again, keep your lashes and eyelids closed. And the longer you let it sit, the more effective it will be, in my experience. The instructions say you can just rub it in and wash it off, and you can absolutely do that. I just prefer to let it sit for quite literally 1 minute. And it also allows my hands and arms to recover their strength back and build it back up a little bit if I'm really flared up. That being said, once you wash it off with water, then I have to go in with one of two things, depending on what time of day it is, or if I'm really flared up. OcuSoft Lid Scrub Original has wipes. These are wipes that you can use every few hours or morning and night. When I have an active infection that I'm fighting, I will use these 3 times a day, religiously. The other type of lid scrub they have, it's Lid Scrub Plus. This, you don't have to rinse off. At the end of the day, I'm pretty done. I'm pretty toasted. So a lot of things get more difficult. This is really nice because I don't have to wash it off. And yes, it matters when you have extreme weakness. So, or if I'm flared up and I have an active infection, this also helps because, again, every little bit of strength that you save can make a huge difference. The thing that I do want to point out about these wipes is that there are specific instructions to use them, and there's a YouTube video. I will try and find the post because it's very helpful, and they go through how to use it. But you basically put it around your finger, and you do one eye at a time, and you will actually wipe the lid itself and under, and then you'll go in and you'll do this, and you'll get right, not touching your eye, don't touch your eye, but you'll get it right on the lid, and you'll just kind of lightly move it back and forth. That's all you need to do. And you just like that. And then it'll have you pull it up and then move it. What I've found, because I'm really squeamish about things being near my eyes, I hate it. So this is like a weird form of torture. But what has made it easier is when you're doing things like wipes near your eyes, you can just look toward your nose and then lift so that your iris isn't close to it. So if you bump it or something, it's uncomfortable, but it's not as painful, and it's also less nerve-wracking because you don't see this giant white thing coming towards your eye. However, when you are washing this off and you're rinsing, you're just gonna rinse. But what I've also what I think helps is having a nice fresh washcloth and just gently rubbing it off, because you have to keep in mind, if it's dry skin cells that are causing your cysts or things like that, your eye infections, the washcloth and the texture, it doesn't have to be really rough. It can't be, because it's your eyes. You want to be gentle, but that washcloth is some added texture to help take more dead skin cells off. And when you do this every day, you can go back, well, I can, to wearing more eye makeup if that's what you want to do. But the important thing is to wait until the redness or any kind of bump is gone. You could probably chance it if you want to, if you're feeling dangerous, but I would be really diligent about wiping and doing the regimen. Also, there are options with your optometrist if doing this stuff doesn't work for you. Occasionally it doesn't for some folks. There is an option to go to your optometrist, and they have like a type of light therapy type of thing, or like I can't remember what it is. It's like a laser or something, but it kills the dead skin cells. But again, I really want to avoid that because I don't like giant things near my eyes. That's just me. Well, I hope these tips and tricks help you. And if you don't find what you were looking for here, I hope you're able to find it somewhere else. But take care and have a great day.